going to tell you a little bit about our experience. First of all, who we are and why we're here. We're a fairly big hospital in Spain that attends around 200,000 people. And we have a problem in our outpatient department because we were running below 60% efficiency while using our healthcare resources, and we needed some support in that thing. We're kind of aware what was our problem, but we were not sure about how to express it and how to solve it. So what we do, what we started with was our unmet need, which is where all the innovation starts. There was an increasing accessibility problem to healthcare services. We run a beverage system in here, healthcare system here in Spain. So we have like infinite demand. So we need to prioritize our patients in different waiting lists. That means managing the different healthcare resources and try to allocate every resource to where it's most needed. That's kind of difficult. We have what we call a very solid base camp because we were very aware of the systems, the data, all the restrictions between that. But for us, the base camp was not enough. It was like trying to climb a very big mountain. We were at the very bottom and we weren't sure how to try to reach that summit to solve that problem. We started with, as I said, with an unmet need, but it was lacking a solution. But with the InnoMatch program, we tried to move that into a proper challenge. It was an actionable formulation of the problem and something that we can provide to external organization to try to solve that problem. In that regard, we are forever grateful to the whole InnoMatch program, to Success, Civita, and TIC-Biomed. TIC-Biomed was our designated partner in that journey that helped us to transform that unmet need into a proper challenge. What we did indeed was providing us with a compass and a map to try to reach that summit, which was the final goal of our project. From that, we move on to the open market consultation because we lack one very principal component to our problem. We needed a partner to try to solve a technological partner to try to solve our problem. We take the role of buyer. We bring to the table access to the public sector and corporate clients. We provide market validation, but we need more on that. The supplier came in. We were involved in an open market consultation with the help of the InnoMatch team that tried to find a supplier that provided a tailored solution to our problem and provide the technological expertise and the technological part of the project. We went through a co-creation, and this is very important to say. We tend to think that the co-creation is not only because the buyer and the supplier, the InnoMatch team provide a lot of support along the way. So this is like a three-team co-creation program. They provide. It's very important to state that the risk reduction that the InnoMatch team or the InnoMatch in the future will provide to this one, and also the financial support to the project. Through that open market consultation, you finally found our companion to the journey, who was Grafenus. This is an SME that is here in Spain and provides all the technological part of the project. I want to state that the co-creation is a very enrichable situation, and going through all the co-creation with a technological partner allowed us to build our capacity in the innovation process, and we have fond memories of the two teams working together at the hospital, trying to understand the day-to-day operations. They tell us about the technological part. It's a very enriching process. This is the co-creation of the solution. I will not go into detail, but what we will try to do was provide an algorithm that try to know what demand we expect in the following months, and after that, using a modeling of the resources to provide a specific allocation of resources to try to answer that demand. So where we are now. We're very close to the summit now, and we're providing the final results of the project in following month. We're bringing here a little bit of our results. This is how our typical schedule in the hospital look like. Our preliminary results show that we have reduced the empty slots in the schedule around 60%, which is a high number. and we have also improved our availability for slots around 22%. Now the schedules provided by solutions look like a lot more like this. From here, we're not stopping here. Once we reach the summit, we tend to think that we want to continue in the future. We want to extend the solutions, further developing it, providing more modeling, more improving the UI. We have a lot of things in mind, but also we want to extend our relationship, because in the end, one of the goals of the whole InnoVire and InnoMatch project is to secure the sustainability of the solutions, and we want to secure a contract with our partner, with the SME Graphenus, to continue developing the solution immediately after the program ends. As I said, it's been a very enrichful project for us. We have learned a lot. I think both parts have improved in our innovation capabilities. And I think it's very important to conduct such an undertakings, that we have to co-create a solution between buyers and suppliers to try to ask or provide an answer to these problems we have in healthcare, but also in other sectors. I don't have to extend very much more. So any question you have, I can ask you in the next section. Thank you very much.